Hello everyone and welcome back. My name is Michelle and today I'm going to be covering a crash course on Duchenne muscular dystrophy. Here is a basic breakdown of the content I'm going to be covering in today's presentation. The etiology of Duchenne muscular dystrophy. It is an X-linked recessive disorder. Therefore, the prevalence is much more in males as compared to females. It is due to an absent dystrophin protein and highly associated with a positive family history of Duchenne's or its other variants. The clinical presentation of Duchenne's include large firm calf muscles, toe walking, lordotic stance or a wide-based stance, waddling and Trendelenburg gait, positive Gowers test, and the diagnosis is usually obvious by 5 or 6 years of age. To confirm the diagnosis, we can run our routine blood and find an increased creatinine phosphokinase. A muscle biopsy is not needed for the diagnosis, but if you do a muscle biopsy, you will see variations in the fiber size in the internal nuclei as well as split fibers. There is degenerating and regenerating fibers as well as fibrofatty tissue deposition. There is no cure or treatment for Duchenne muscular dystrophy, so there is only symptomatic management. And the mainstay of management is to maintain the functional ambulation of the patient for as long as possible. This means keeping the patient walking, stretching, and bracing. And when the surgery is indicated, a foot and hip contractures should be released simultaneously for symptomatic relief. The prognosis of Duchenne's. Most patients would lose independent ambulation by 10 years of age, and they are commonly wheelchair-bound by 15 years of age. They usually die before reaching 20 years of age due to cardiopulmonary causes. And steroid use is a bit controversial. It may prolong the disease process, but it does not cure it. Other variants of Duchenne muscular dystrophy include Becker's muscular dystrophy, limb-girdle dystrophy, facioscapulohumeral muscular dystrophy, and myotonic dystrophy. And that brings us to the end of today's crash course. I know that it is very little information, but if I missed anything important, please leave it in the comments below, and I hope that this video helps you in your examinations. Thank you and see you next time.